Hey Facebook family, this is day number 15 of my hospital days. It's 10 o'clock in the morning and Dr. Akemian just left out of here. He told me he was going to discharge me today. He feels like I've been here long enough. Well, Dr. Akemian, you know what? I can agree with that. I done been in here long enough. But blood cultures was drawn this morning, you guys, and we don't know if there's still bacteria growing in my system or not. He says that whatever type of staph infection this is, it was caused. It's got something to do with my skin, maybe, or maybe they didn't clean my port well enough when they were using it for medicines or transfusions or something. And I know that blood cultures take a couple of days to come back, and I know good and well if he came in here this morning and the blood cultures weren't drawn to about 8 o'clock this morning, there's no way that the new results are back. Good thing, no fever anymore. Bad thing, blood count 8.3. So I asked him, well, what about blood transfusions? Are you not going to get my blood back up to a more normal level so I don't have to come back over here? And I was told that he's going to let me go home. And Julie, one of the charge nurses, just stated to me that he said that he was going to let me go home, and that, if Dr. Aarons wants to keep me from a sickle cell perspective, that I would have to be the patient to call the doctor, that the hospital could not call for me because Dr. Akemian was the attending physician on my case this time. And if I wanted to do something about my blood, then, I don't necessarily have to stay in here to be blood transfused, because that can be done as an outpatient. I do understand that. But if you already got somebody over here at the hospital and these things need to be done and taken care of, why would you make me go through that? That's my question to you guys at Gaston Memorial Hospital. Me and Dr. Akemian have bumped heads a whole lot on this hospital admission, and it's just like he wants to tell me whatever he wants to tell me, then he just jets off about his business, and he don't even really give you time to question him on anything. You have to interrupt him, because he would damn sure interrupt you when you trying to ask him something about your own body. And, I've never been told before by Gaston Memorial Hospital that, once he discharges you, then you have 90 minutes to get out of this room. Really? I don't think so. I've never been told that before. And maybe he told her to say that. Who knows? I can't even be mad at Julie. They know me well over here, And for the most part, as far as speaking about the nurses over here, they good to me, and I won't tell you no story. I have repeated that continuously since I have been here. But, it kind of sounds kind of stupid to me to send somebody home. Their blood count is low. That is a part of why they have anemia in the first place. This is why it's called sickle cell anemia. But if I got a blood transfusion when I was first admitted here, and normally after I do an exchange blood transfusion, my blood count hangs around 10. Well, I got that, and within 3 days after getting that transfusion, my blood count ain't but 8.3. That ain't a good thing. That means that my body is still killing a lot of my red blood cells because they're sickled. So my question now is, where do we go from here? But as always, I promised I would keep you all updated about what is going on. I told you that this is an emotional journey as well as a painful one when you're dealing with people in this field, and it breaks my heart. It really does. It breaks my heart, because when growing up, I wanted to be a nurse, and I wanted to be able to take care of people. And just seeing and being treated the way that I have been treated by some of my doctors is unreal. And when I say I don't want nobody else to have to suffer with this disease, I mean that from the bottom of my heart. I wouldn't wish it on my enemies. And I've had so many ups and downs with it. And then, you know, for them to be sometimes they some of the cold-heartedest people I have ever seen, y'all. And it makes me cry. You can't help but to cry when you see people be treated that way. I know I couldn't do it. I don't know how they sleep at night, knowing, you know, that they do somebody like they do them. I mean, it's sad to say, but damn, animals get some better treatment than people do sometimes. We forget about people. We don't value them as much as we do an animal. What is so wrong with that? What is wrong with the mindset of that? But like I said, you know what? I'm a survivor. I will get through it, but it hurts and it knocks you back a step or two when you see people be treated that way. And you know, I just feel like if it were not a disease that affected primarily African Americans, I would get treated better. And a lot of other patients that are sick and need to be treated, they would get treated better, you know. I get so tired sometimes of being treated just like a chart number or like some money from insurance company, and you get tired of dealing with doctors that look through you and they don't even try to empathize or try to understand where you as a patient, you have to live with it every day. They don't try to see where you're coming from. That is what is most hurtful about having sickle cell disease. And you know, I'm a tough little cookie. I'm gonna hang in there. But at the same time, you know, people be trying to tell you, oh, well, you can't give up now. Why? Why come I can't give up when I get treated like that? And it ain't just sometime, it's all the time. You know, I used to didn't get treated like this when I was a kid, but it seems like when you become an adult patient that has sickle cell anemia, they treat you like a dog. It's a totally different world. But still I rise and still I stand, and it's gonna be okay. If I gotta come back or whatever, I just gotta do what I gotta do, because I'm gonna take care of me regardless of what they say, how they feel about me or whatever. I'm gonna take care of Toya. Y'all know that. But I tell you, when I tell you I'm tired, you can take it to the bank when I tell you I'm tired of being mistreated by people in the medical field. And I didn't mean to start crying. I really didn't. I want to go home, because I got plenty of things that I could do with my son. You know, I miss him, and I'm sure he misses me, even though he's gotten to come here to the hospital to see me. I miss my baby. But, I mean, when I go home, I want to be able to stay home for a while. I really do. But I've been thrown this curveball today, and it's fine. I'll be all right, y'all. But I'll keep you all posted, and we're going to keep on praying, and we're going to keep on searching. So on that note, I'm going to let you guys go, and I'm going to pack up my things and wait on the hematology doctor to call back to see what's up, and if something changes between now and my little 90 minutes from now, I'll let you know. Talk to you later, Facebook fam. Love you guys. Bye.